Welcome to Social Impact Live, a weekly conversation with members of the Columbia School of Social Work community. I'm Richard Hara, your host, and let me see, I think we've got everything up and running now. Hopefully people are able to open up the chat box, let us know where you're tuning in from would be great. Also, just a reminder, we do reserve the last 10 minutes for Q&A, but if you have a question, please feel free to type it into the chat box sooner rather than later, and that way, hopefully we can just weave it into the conversation. So without further ado, and apologies for our somewhat late start. If we have an opportunity to run a little bit longer, we'll certainly try to do that to get in all of the material today. But I'm so pleased to welcome back to our program Associate Professor Courtney Cogburn. Courtney, welcome.
Hi, Richard, how are you?
I'm very well, thank you. I hope everything's well with you.
Doing fine. I'm joining you from a car, but everything's going fine.
But it's nice and sunny out there, so that's nice. And yeah, I mean, we do this program from everywhere. We've got people tuning in, from literally around the world. So why not broadcast, from a car as well? So, and it's just so great to have you back here on the program. You've been on Social Impact Live before, part of I guess, panel with other guests and so on. And it's great to have you here alone so we can really focus on the work that you've been doing.
Thank you.
Particularly with regard to your most recent project, I guess, using virtual reality to teach racial empathy, to work within healthcare. So we'll have a chance to, I hope, talk a little bit more about that. I just want to give a nod to people who are tuning in from New Jersey, Rhode Island, Philly, Brooklyn, Hudson Valley, the Bay Area. I wonder if that's San Francisco and Yonkers, South Carolina. So it's great to have everybody, awesome. Tuning in.
Hi, everyone.
So yeah. It really is not just a great to have you on this program, but really a privilege that you're a part of the Columbia School of Social Work faculty, doing the work that you're doing. That's, this trend, I guess you could call it, of social scientists and activists collaborating with storytellers, creative technologists, and data science, and so on. It really is amazing. I read somewhere that you were on a panel, and I mean, you're doing your piece, and somebody else from like Disney is also sort of speaking, and it's just a testament to just the incredible opportunities that social work as a discipline has, sort of moving forward. And you're working primarily in this area now, focusing on how to create these immersive experiences of racial injustice and so on as a teaching tool, and so on, and a way to address, systemic and structural racism.
Yeah, I think during my short academic career, I've just been exploring the boundaries of what role does a scholar play in society? What is the role of myself? What is the role of my scholarship? And have really enjoyed testing and pushing those boundaries. Where do I and where do social workers and where does social work belong? I would argue all the places. And so it's been quite interesting for me to explore spaces in which I think social work sort of serves an important role. And that's been in tech and media, and as we're talking about today, medical and healthcare settings as well.
When I think about virtual reality and social work practice, I think about, those interventions that use virtual reality as part of exposure therapy and so on. So, but I'm just wondering, how did you sort of get introduced to VR? I mean, what was the point of entry for you?
Yeah, social workers have been working in this space for quite some time, thinking about clinical applications, might you treat PTSD, or a range of ways in which social workers have been thinking about virtual reality For me, I was interested in improving the ways people engage and understand what racism is, particularly structural racism, and how it functions in society. And in my experience, the misunderstanding of structural racism was leading to a misalignment with our solutions. So the things that we were attempting to implement to help address structural inequalities weren't really reflective of a clear understanding of how those structural inequalities exist and came to exist and how they're maintained. So I thought that maybe creating something in virtual reality may help people to connect in a deeper, more visceral way. Sort of maybe moving us beyond data to think about the human realities of these experiences might help people to engage differently. Um, I knew nothing about virtual reality when I started. I'd never worn a headset at the time that I wrote the proposal for this project. But as you said at the outset, you partner with people who have skills that you don't have and sort of blend your skills together in the sort of transdisciplinary approach to find new solutions to complicated problems. So I reached out to a fellow academic at Stanford who had been working in VR for over 20 years and asked if he wanted to partner on a project like this. So, bridging his expertise in virtual reality with my background, thinking about racism and what that means to try and see if we could find a solution together in VR.
And this was the genesis of A Thousand Cut Journey, correct?
This was the genesis of A Thousand Cut Journey.
Yeah.
Yeah.
So, and for those of you tuning in who aren't aware, A Thousand Cut Journey was part of what, 2018, 2019 Tribeca Film Festival?
2018. Yep.
2018, yeah, and made quite a splash, I think. I know that there was coverage in the New Yorker and CBS News and so on, and to sort of see social work kind of, having that kind of impact is really, I must think very gratifying for you.
It is. And again, sort of going back to this sense of my testing boundaries of my role as an academic and as a scholar, um, we have to think about what impact means. And maybe we need to broaden what impact means, right? So there are the important channels of where we disseminate our work in academic journals, where our research is peer reviewed. And then there are these other types of engagements where we're shifting public discourse and helping the general public think about an issue differently or perhaps engage in an issue differently. And I think social work and social workers are just important in those public spaces as we are in research and academic spaces. So yeah, the work in VR has sort of led me to this public engagement in ways that I hadn't planned for or expected.
Absolutely, and sort of gauging that public response is really important. And I think we've got a video, that we've made, sort of talking with people after viewing 1000 Cut Journeys. So if we could cue that up and maybe stream that for our audience, that would be great.
It's been interesting. It's a whirlwind. It's been exhausting, but I think really fulfilling. 1000 Cut Journey is a virtual reality experience. We immerse you in experiences of racism from the perspective of a Black male who's having these experiences at different points in his life. People's reactions have been mixed. I think people generally have been touched, have expressed learning something new and different about experiences of racism that they didn't know before. I think it's a very active and innovative and growing space. People are becoming more experimental with ways to use this medium, pushing public discourse around timely social issues. Certainly seemed to be a theme for pieces this year. We've had actors and directors come by. It's been moving for prominent people who work in the industry to react so positively to some of the work that we're doing, given that we're not filmmakers, but trying to tackle this complicated social issue.
Okay, wonderful. What's it like to sort of go back to that time and sort of see some of those scenes there, Courtney?
It's really exciting. I just never pictured myself being at the Tribeca Film Festival. when I sought to be a professor, at a university. So, pretty cool. I felt pretty hip. I felt pretty cool to be in this, this exciting space. And again, it was a representation for me to think about, well, what role do I serve in terms of social impact? Where are the spaces where I can help have influence? And that was just one of those very clear examples that there were people who were willing and interested in thinking about the work that we're doing in the academy well beyond the walls of the university. And so for me, it was a representation of that. And it was the first place where I got connected to organizations like PricewaterhouseCoopers and other major institutions. So yeah, pretty exciting.
And so yeah, so talking about innovation and growth, and so now you've used 1000 Cut Journey as part of a training you developed for healthcare leaders, I guess faculty and staff at a local medical school, I believe the Zucker School of Medicine, associated with the Northwell health group hospital system and so on. So it's a big organization. So yeah. So what were your goals? I mean, in doing this kind of project with healthcare leaders?
Yeah, I would say at the outset that it was very experimental. We were thinking about sorry, we were thinking about just could we meaningfully and authentically represent these sorts of experiences in VR? It was very exploratory. Once we started to make progress and started to get feedback, post the film festival, it became clear that there was an interest in using this as a training and educational tool. And so we started to explore ways to do that, working with corporations. And one organization was Northwell Health. And they were particularly interested in thinking about this as training for their senior administrative leadership. So these are people who are guiding curriculum in the medical school, people who are making major decisions for the institution and where they're going next, and wanted to have this body of people in the organization grounded in an anti-racist perspective. What is racism? How does it function? And how do we respond to it? What do we do about that? And we're interested in engaging us using the VR in addition to other training mechanisms that they already had in place, to see if the VR was an enhancement to what they were already doing. So we were excited to explore that with them.
Yeah, I think it's important to note that it wasn't just a VR experience, right? There was a whole training piece that was also connected with it around microaggressions and so on. So I think certainly that's an important context, right? For anybody trying to use VR as a training tool, or I mean it's interesting because when I first read the article, I was wondering about just the whole idea of empathy, right? And sort of giving people this opportunity to experience empathy, but what do you do with empathy, right? That's the thing. And I think one of the takeaways from the paper that came out of this project was that the people who took the training and so on not only felt that they could better empathize or have that empathic experience, but it would change their behavior, right? Working with people of color, or in terms of the policies, they would think about what that experience would be like, particularly in the area of communication. Is that correct? Or
That's absolutely right. And so, to the first piece in terms of the additional training. So we don't claim that VR is any sort of magic pill that you're going to put on this headset and then suddenly you'll understand everything you need to know about racism and how it functions in society and what you should do about it. So we think it's most powerful when it's coupled with considerations outside of the headset, be that a full 14-week course or training, or right, the things that you need to do to help reflect on and to help translate the feelings and emotions that are coming up in this headset to something outside that's getting applied to the real world. So that's critical. And then I think another, and that included, like you said, microaggression training, and those sorts of things. So that's really an important piece. VR is often touted as being, the ultimate empathy machine. This is a famous quote from Chris Milk, who's a prominent creator in the space. But I actually push against that to argue, to your point, that empathy is insufficient. Just imagining what it feels like to be in a situation doesn't do anything to say I take personal responsibility for how I benefit from these same systems. I have some clarity around my own social advantages as a result of being a part of this system. And so, that says nothing. Empathy says nothing about behavior. How are you acting differently? How are you thinking differently about these issues? In your relationship to them as a result of coming through the VR. So I think we're really trying to think about not just empathy, that's not insignificant, but really arguing that we need much more than empathy if we're going to see real social change, real social impact. And how do you design experiences with that in mind? How do you design not just to move people to tears or to feel emotional in response to something, but to really see and understand how that experience they've had in the headset manifest in 1,000 different ways outside of the headset? And what are they going to do about that? Right? What is your relationship to this very real social problem? So that's always been a central piece of what we've been trying to focus on.
Is it something though that you can actually build into, as you sort of put together the VR piece? Because there's a question here. Do you have ideas on how you want white people to behave after achieving this sense of empathy, or do you want them to sort it out for themselves? So, does empathy sort of prime the pump, but we have to, people have to sort of sort it out for themselves, or should there be some sort of guidance, some sort of idea of where to take that for the next action step?
I mean, I think we all have personal responsibilities on where we go and how we use information once we've received it, and how we engage data, and how do we engage our own practice around racism and anti-racism. So there's certainly a degree of personal responsibility and accountability there. But I think what I'm also saying is that there are meaningful structures we could build around VR experiences that help people grow and deepen their understanding and figure out ways to engage. So you don't just put them in the headset and let them walk away. Maybe you sit and have a conversation. You go through, a number of well-established trainings that help people think about this. At the School of Social Work, we're thinking about this in relation to our decolonizing social work and foundations course. Can the VR coupled with this course help our students grow and enhance and deepen their understanding? So I think it's a combination. Certainly personal accountability is at play, but there are curricula that we can use to help people translate, deepen, and lengthen their engagements around these issues.
So, so the curriculum that's where we make the structural change, you think, or you're suggesting?
I think it's an important piece of it. Yeah, I think it's an important piece of it, because if you just leave it at VR, you have this emotional experience. A Thousand Cut Journey is very emotional for many people. As the user's question suggests, our target audience were white people, in particular white liberals. You want to sort of to be jarring. I wanted it to be a gut punch. I wanted it to be a reality check around what racism is. I wanted it to trigger understandings about whiteness, even though you're experiencing this lived experience through a Black male's perspective. But that's all of what we present in that is not just emotional, it's structurally and socially grounded and very, very complicated. And that requires some thought and reflection that likely needs some, guidance through that thinking after you've come out of the headset. So I think it's a really critical piece.
Yeah, we have a question here that may be connected to what you're saying. I know you, Professor Cogburn, in that video said you use virtual reality in order to show the public how Black males are treated in society. Have you also exhibited during these VR experience how women are impacted as well? So yeah, I mean, it's being able to empathize, sort of experience things, feel things, understand things in someone else's shoes, if there are certain aspects of shared identity, what happens when, there are significant differences and so on? Does it
Yeah.
work or?
Yeah, I mean, I think there are a lot of people working in this space
Mm,
who are thinking about different social positionalities and identities and how we might embody different experiences. There's a team out of Spain, for instance, led by Mel Slater, that's thinking about men who are in domestic violence treatment embodying a woman's perspective in
mhm,
VR as a part of their treatment program. So there are, lots of sort of thoughtful work that's happening in this space. I think there's lots of different identities to occupy to help us understand some of this. But it's quite expensive and time consuming to produce these pieces, and it's not as simple as let's switch out your avatar and make you a woman and you go through the same thing. It's, we
mm,
know lived experiences are much more nuanced than
mm,
that. I couldn't just switch out a Black woman, for instance, and have the exact same thing happen. I don't think I would design the same experience.
mm.
But there's lots of important work to be done in this space. And we're certainly working on new projects as well.
Yeah, and sort of just looking at the range of identities, right? That you could be working from, but also different positions, right? And there's a question here. Any thoughts about using something like this in police departments? I assume, training police and so on. And what would that be like? Any thoughts about that?
Yeah, I get that question a lot. I did an interview, I think it was the New Yorker. I might be
Mm,
mixing it up. But no, I think people are working in this space. They're working with police departments. I am not especially interested in working with police departments. I have some very particular views around police and their function in society, and it doesn't involve me training them to do their jobs better. And so, but there are certainly people who are using VR to help police officers be more aware of conscious or unconscious bias in terms of their reactions to people that are involved in interactions with them, and documentations that they're more likely to pull a trigger in VR when
mm,
the suspect is Black, uh, and that going through VR training repeatedly reduces the likelihood of that happening. Um, so there's certainly people working in that space. I'm not interested in working in that space.
mm. But certainly, there's potential, right?
There's
As a
potential,
tool
yeah.
for, just to sort of reflect back on what their behavior might be in particular situations, particularly when issues of race and so on are
Right,
there
right.
and are a factor. Um,
And just quickly related to that, I think an
mm,
important piece of this for me is I am less focused on changing individual behavior. I'm less focused on reducing individual levels of bias. And my focus has been helping people better see, understand, analyze, and engage systems. So, how can I help individuals think about how systems function so that they
right.
can start to engage and problem solve at the level of systems and
Mm.
not problem solve at the level of individuals? So, my work in general has a more macro focus.
Sure, going from case to cause and policy with a small p and a big P. So,
Exactly.
yeah, and the traditional social work approach is there a way to measure the impact after utilizing VR? I know it may lead to empathy, but has there also been other post surveys or ways of measuring whether behavior has actually changed due to the VR experience? Yeah, what does that empirical literature look,
Yeah.
for VR used in this way?
It's growing, right? So there's the work I just mentioned around domestic violence where they're tracking
Mm,
how men are responding to treatment differently as a result of having gone
right.
through the VR, and they're using different types of data points to try and assess, their own reflections about their behavior. We're using a mixed methodological approach. We've run a few different studies now to try and get a sense of what's happening to people when they go through this. We can measure, different types of attitudes. We can measure the ways in which people view systems. So, for instance, system justification. How comfortable are you with the status quo, as opposed to believing that structures and systems are playing an important role in the productions of inequality? And then we also get qualitative data. So we have people reflect on scenarios and see how they're analyzing scenarios potentially differently as a
Mm,
result of going through the VR.
mm,
People have also done interesting things like, are you willing to donate money to a cause? Are you willing to sign a petition? Are you willing to spend time writing a letter to a group of people who are represented in the VR experience as ways to get a sense of behavior? Um, the empirical work in this area is still, very much in progress, and so I think people are still exploring methodological approaches to really assess what we think is happening in VR. And it frankly, it requires some creativity and innovation to try and really sort of put a pin on these complex psychological and behavioral responses that I think people are having. So we're still exploring.
mm. All right. Well, I'd love to do the deep dive
I
into
know we could talk
the
about just
literature.
that part all
Yeah,
day. Yeah.
yeah. But do. We've got maybe 5 more minutes. I hope if that's okay with you to
Sure, I'm
maybe
happy to go. I
address.
know we got a late start.
Yeah.
My apologies. I'm happy to go a little bit longer if
Okay.
people are interested. Yeah.
Great. Yeah, because we have a few more questions that I'd like to get in from the audience. One question, the funding. You talked about funding, and
Sure.
it
Yeah.
requires a lot of money. Where did it come from for 1,000
So
Cut
our
Short?
initial funding came through the Brown Institute for Media Innovation, and
Mm,
they're housed in the Columbia School of Journalism, actually. And they have something called a magic grant. And these are grants that are intended to support big ideas related to how we convey narrative and story. Journalists, right, combine research and storytelling to try and convey information to the public. And so we sort of fit into this. We are trying to change the way we tell the story of structural racism. How do we convey information about structural racism? So they were our first funder
wow.
for this project, and quite grateful to them. And I encourage people. The Magic Grant is open to anyone, so I encourage people to look into it if they have some ideas that they think might be a good fit.
I mean, it sort of raises the question, to be effective social workers, and as you were saying, maybe, as academics and scholars, maybe we need to start watching more movies, or we need people from Hollywood because I always thought that, there's this connection between therapy and just art, and that you're using some sort of symbolic means to create an experience in people.
Yeah,
And there must be connections, there must be parallels in the process. And now we're sort of like intersecting in so many different ways,
yeah,
and I don't want to
yeah.
say it's entertainment, because it's more than that, right?
It's more than that. Yeah,
But it engages people, and it really gets them to sort of invest themselves, right, into
absolutely.
the
Yeah.
experience.
Yeah.
So
I mean, we're doing storytelling all the time. We're trying to convey the significance of a problem. We're trying to convince policymakers of something. We're trying to convince voters of something. We're trying to convince our patients of something. We have to think about narrative and storytelling, I think, as an important part of that. And sometimes that requires collaboration, right? So the new project we're working on, we worked with filmmakers, their storytellers, and we were interested in how they would tell this story. How would they tell the story of structural racism,
wow.
working closely with us as scientists and social workers. And I was ever since I went to the Tribeca Film Festival, I was like, oh, wow, like what would I make if I actually partnered with a filmmaker to see, what we would create. And there's interesting work happening in journalism, of course, in medicine, in social work around narrative and storytelling that I think are, those intersections are really, really important. And you said it's not just about entertainment, it's about conveying information and
Right.
how can we best convey information. Interesting work in psychology happening in that space as well. So what types of story, humor versus fear, work very well. Health communications thinks
Mm,
a lot about this. How do we convey information in a way that helps people make better decisions about their health, for instance? So
mhm.
it's a really important space. And I didn't really understand the significance of it until I started working in VR.
Well, it's incredibly exciting, and I think we have a number of students and people out there tuning in today who are interested. And the question here is it possible for people from the public to experience this project, or do you need to be a CSSW affiliate or part of a study? I mean, is this something that, at some point, the general public will have access to, or?
So we just set up a website. I'm actually not even sure if it's live yet. If not, it'll be like this week. So when I say just, this is actively happening, where we're making the experience accessible for non-commercial use. So anyone who wants to experience it, the short side there is that you have to have VR equipment and the computer that runs this. So it's not exactly accessible. You already have to have the equipment. We're also partnering with Microsoft. Their research technology centers. They're interested in putting the piece in their technology centers so that the public can go into those spaces to experience it and make it more accessible. So we're actively working on ways to make it useful and accessible to the general public. But that aside, pre-COVID, we have a space in the School of Social Work where we have equipment set up and have run demonstrations for small groups. People have invited us to their organizations. We have mobile units where we can go out to organizations and schools, et cetera, to run demos and experiences. And hopefully we're able to get back to that fairly soon here. But yeah, we're still, that's one of the digs about VR is that it's not very accessible yet. And we're actively exploring ways to make it as accessible as possible.
All right. So as far as that's concerned, still a work in progress, but for all of you out there, as we like to say, stay tuned. And
stay tuned. Look for the website. If you happen to have access to equipment, we give you the specs for what you need to run everything on the website in great detail. But yeah, stay tuned beyond that.
All right, then. Well, we'll leave it off there. Courtney Cogburn, Associate Professor of Social Work at the Columbia School of Social Work. Thank you so much for joining us today. It's Social Impact Live. Thank you.
Thanks, Richard. It's always nice chatting with you.
And just a quick program note, we've got Erica Eliason next week to talk about the impact of Medicaid and how it's been lowering maternal mortality in states that have expanded Medicaid. So look forward to seeing everybody back here next week. Thanks for tuning in today, and take care, stay safe, and see you next time. Bye-bye.